Open enrollment. Hello friends, welcome to First Gen Money, a YouTube channel for all things money and lifestyle from a millennial's perspective. It's open enrollment at my job and I decided why not make a video about how I'm going through what to pick and what I did last year, my first year ever, and some mistakes that I made and all that good stuff. This isn't going to be a video that breaks down like all the intricacies of health insurance. I don't really even get it myself all the time. I'm still kind of figuring it out. But what I am going to give you is kind of a framework for how I went about picking my health insurance, what I say when people ask me how they should pick their health insurance. So if this is your first time going through open enrollment or you're trying to think about it differently, I hope that this video helps you in some way. I know for me, last year I turned 26, and so it was my first year signing up for health insurance on my own, and I was like, what? So I was a little confused. I ended up picking a high deductible plan, which I'll go into a little more later, but was kind of I don't want to say a mistake because I don't think it was a mistake, but it definitely prevented me from wanting to go to the doctor a lot. So let's dive right in. Before I start, I do want to give a few definitions because I will be throwing these words out and I want you to kind of have a grasp of what I'm saying. Number one, what is the difference between an HMO, EPO, PPO plan? I have no idea what I just said. Yeah, I don't either. Anyway, I'm copying this directly from the website, resources website, which I will link in the bio, but basically a EPO which is my plan, an exclusive provider organization, which provides in-network coverage only without pre-authorization. So you're in network. This is what, when you say, oh, when you call your doctor and you're like, are you in network with Aetna, blah, 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 blah. You have to run your stuff. That's what they mean. And then HMO is a health maintenance organization, includes regional networks with limited providers, and plans always require referral to see a specialist. So basically, in order to go see a neurologist, you need a prescription from your main physical person, your main physician. There you go. PPO, Preferred Provider Organization, is a healthcare organization that has agreed to provide healthcare through a network. Care can also be provided by out-of-network providers, but higher fees may apply. Those are kind of like the categories of health insurance that you can, they're plans. There are different plans within the health insurance options that you can get, and a lot of things vary between all of them. I think for one, it's important to note that the deductible might change, and a deductible is basically the amount of money that you need to pay before your insurance kicks in. So, the insurance company, if you have a high deductible plan, which is what I did, you are going to be paying a lot more out of pocket until you reach that high deductible. And then after that, they cover everything 100%. So that's a high deductible. But there are different things that terms you should be aware of, like copay. Copays I pay after my visit, and I pay it because even though I have health insurance, there are some payments that you have to make towards whatever your visit was. The visit is covered by the insurance, but for every visit you have a specific amount that you need to pay. And it's usually designated before you sign up for insurance, like, for your regular physician. Might be cheaper than going to see a specialist. Those are usually where the differences in copay vary. If you have a deductible and you're paying copays, that doesn't go towards your deductible because copays are part of the plan that you selected with the deductible. There are two things that come up a lot when you're looking for different plans, and that's the FSA and the HSA. So the FSA is a flexible spending account, and basically what it is it's a benefit to people who want to use their pre-tax dollars for specific costs. And how that differs from an HSA is only available if you have a high deductible plan and you actually can invest the money that's in there after you've reached a certain amount. But also it's pre-taxed, so it's similar in that sense. With your FSA, if you don't spend the money that you have in that FSA, you lose the funds. Whereas for an HSA, you can get that rolled over. And then lastly, before I go into my experience, what does in-network versus out-of-network coverage mean? Some plans will be only in-network, and that means that you can only see people who have been like pre-approved by the plan insurer that fit that network. And anybody you see out of that network is going to be considered out of network and maybe not even covered by your insurance, and you'll have to pay for all of that. So it's always important when you switch your health insurance to be calling your doctors and say, hey, this is what I'm thinking about switching, especially if it's your first time transitioning out of, somebody else's plan. If you just turned 26 or like this is like the first time you're doing it, you want to make sure that if you really care about like who your doctors are and you want to keep the same doctors, that you consider like who is in network versus who is out of network, and if that means you might want to have a out-of-network plan. Okay, so as I mentioned already, last year was my first year out of my parents' insurance. I had just turned 26, and I was making the decision in November about who and what insurance I was going to go with, or plan I was going to go with. At first I had heard a lot about high deductible plans and the ability to have an HSA because of the investing benefits to it, right? Like you can invest that money and then keep it there for years and have money in your later life to use towards health expenses. And that's a huge like tax benefit thing. I mean, I don't know much about that, so I'm not going to go into the specific tax stuff, but the basic is that like if you're putting money before taxes and you don't have to pay taxes on that, if you're purchasing things or you're using the money in the HSA towards health related things, then you're obviously getting a benefit and not paying taxes for that money ever. So that's a huge incentive right there. But what I didn't realize when I picked a high deductible plan was that I picked a high deductible plan. I got an HSA, but I had to spend $5,000 out of my pocket first before my insurance kicked in. And while I do have that amount in my savings, I think for me it was a mental thing. I didn't really want to go to the doctor because I was a little afraid of how much the bill was going to be. I was like, well, it's all unpredictable. I don't know what doctor prices are. You have to like take into account your how you're going to feel about it emotionally. I know it sounds silly, but I had those $5,000 and I still was like, I'm just afraid to walk in and get something checked out because I didn't know for a fact that I was going to pay X amount of money. For instance, in February, I had a horrible flu. I don't know what it was, but I went into the doctor's office, basically told him what I was feeling. He was like, well, I'd love to give you a flu test to see if it is the flu. And I was like, what's the price of that? And he went to find out the price. It was about $100 and something. And I was like, you know what? It's not worth it. If you think I have the flu, I have the flu. So I just said goodbye and I left without getting the flu test. And it turns out, even without the flu test, my bill was already like $158, which, tell me to pay for that when I go see a vet for Charlotte and I have no problem. But for myself, I was just like, oh, what was the point of that? It's a money mindset thing, right? Like, I know these are things I need to work through because why, if you have the money for it, was I so hesitant? But I was. And while I work through that, I realized that maybe I don't want to put myself in those kind of situations. And if I could, I'd rather just put more money in those monthly costs so I know what that fixed cost is every time I visit the doctor. I don't like surprises. I really don't. It's like going to a restaurant and the menu doesn't have any prices. And you're like, well, I really want this, but I have no idea what it's gonna cost me. Like, no. Basically, my thought process was like, okay, I have the 5K. I can save myself money monthly if I just go this route. And it turns out I really didn't go to the doctor that much, but every time I went, it was over $100. And then I started having foot issues, and then going to the podiatrist was another headache. Had I had a plan that was like, okay, every specialist is $50, then I'd be like, okay, I can account for how my money is going to be spent. But if I suddenly need to go to the doctor and I know I have this much to spend this month, then I'm gonna have to take that money from elsewhere. And I just don't like how it makes me feel. So I made the decision based on how cheap it was gonna be and not taking into account that I had just for the first time like been out of my dad's insurance and was gonna be on my own. And I think, you know, when now we're getting into the recommendation, and I'm not even done about my own health insurance. But basically, when people ask me like, how should I pick my health insurance? What should I think about? It's my first time doing it. I say, listen, if you've never had like your own insurance in the past, go with the most comfortable to you. Even if it's more monthly, like it's fine because you can always pare it down the next year. But if you decided on a really high deductible plan and now you don't want to go to the doctor because you don't know what the cost is going to be like, that's going to do something to your psyche, but also could get you really sick in the long term. Always lean onto the more insured side, especially because it's the first time you're coming out of, or you're doing this on your own. And that's what I'm doing this year. This year, I went from a high deductible and I just enrolled in a zero deductible plan because I know for me that level of like assurance that every visit I go to is gonna be X amount of money is great for me. I need that. Okay, I was rudely interrupted before, but so basically what I'm trying to say is that I don't want you picking a plan out of fear of not having money. I don't want you to have limiting money beliefs, but I also want you to think about what your past and historical insurance needs have been. And you know, for me, I was pretty healthy. I hadn't needed to go to the emergency room or any of that, but past performance does not equal, what is it? The same results. I don't know, whatever that quote is. So just think about what you would be comfortable paying towards your health insurance, how you would feel visiting the doctor's office if, let's say, you had a high deductible plan and not a straightforward copay. So just take those things into consideration. Also, if you are somebody who frequents the emergency room, look at those costs. Just look at it that way. Do a little math. And if you have any questions, I'm gonna try to answer them. Let me know on Instagram, message me, join our Slack. Let's talk about health insurance, but I will leave the amazing resources that I used in the link in the description. So I hope you enjoyed this video. I hope it was helpful, and I look forward to seeing you.